I'm here at Beehive of Healing. It's in Agora Hills in Los Angeles, or just about an hour or so outside of Los Angeles. It's a dental practice and a medical practice with a lot of differences to what you would normally expect. Even when you see the gardens that are around it, and these are for patients to relax and the whole tranquility of it. So it's a really cool place because it's not just about medical and orthodontic care. It's also about bringing a sense of consciousness to the patient. And what do I mean by that? Well, my interpretation of it is that it's a human-to-human connection. It's bringing people outside of their mind, and that we can live more in the present moment. We can be more aware that we're not just living in our heads, because too often we do that. And we really need medical and dental practices to be looking at what does it take to get human beings to be more aware, as opposed to the traditional pharmacological aspect. So in terms of the dentistry and orthodontics, it's not just about straightening teeth, but it's actually about developing the face and airway. And at Beehive of Healing, what is often talked about is posture, correct tongue resting posture, for example, breathing, and that's why I am here. So Zara, and they have a whole team, and Dr. Sami, and they help their patients with nasal breathing, with correct tongue resting posture, and looking at posture as a whole, at development of the airway, development of the face, and with that helps with sleep, and it will help with consciousness. We have to ask this question: can we have a quietness of the mind if we have poor sleep quality and if we have dysfunctional breathing? If we are in a fight or flight out response, and with poor sleep quality, as I had as a kid growing up, we do tend to be in a fight or flight response. It is well documented that children with poor sleep are more prone to ADD and ADHD. So in addressing that, what are the options available? Well, of course, one is the medical route, but with pharmacology, is that really going to address the crux? And is it going to be a long-term intervention? Really what we need to be doing is looking at the child as a whole, addressing the very factors which are contributing to poor sleep quality and dysfunctional breathing. And of course, dentists and orthodontists are in a wonderful position not only to recognize this, but also to do something about it. I'm just going to bring you in just as a little bit of a tour, and there's no beforehand. So as you walk in, you see a purpose-built location. And you see the mantra here: our mouth is a sacred portal to our body and soul. All healing starts here. So it's really starting with that. And of course, here's my daughter Lauren having a good laugh at my efforts to do an Instagram post, as it happens. And here we have pure tranquility. So just taking a walk further on, and we see different products about restoring nasal breathing. And of course, I forgot about something special, and that's a number of books and the Oxygen Advantage. So it's always good to see the Oxygen Advantage and books about nose breathing and functional breathing inside in a dental and medical practice. So just to give you a little tour, and there's nobody here, and this is Love Button. So you may have seen Chris Martin, who is quite a good supporter of the Love Button, and you'll see the website lovebutton.org, and it's a tremendous charitable organization at helping vulnerable children and adults. Because I'm just about to jump on a flight to Hawaii, and I'll do a post on that as well. Take care. Bye.